Hi, my name is Stuart, and I first realized I had a blood disorder when I was 2 months old. I had my teeth removed. I wouldn't stop crying and it wouldn't stop bleeding. We went to the doctor. After a few tests, we established that I had hemophilia.
The medical definition for hemophilia is that it is a genetic condition that causes the sufferer to bleed over an extended period of time because of a lack of a clotting factor that is responsible for stopping the bleeding. However, umehluko phakathi kwe-hemophiliac nomuntu onganabo ubulwele obu ukuthi i-hemophiliac yopha isikhathi eside bona angabe abulawe silonjana. Ngiyanamukela kwesinye isiqephu se-Live It esiphana ngelwazi. Ehlelweni namhlanje sisinqophe ukunifundisa ngokungeneleleko ngobulwele sihelebhe nalaba abaphila nabo. Sizokhuluma noJudy Malani oyi-genetic counselor noDr. Mukhoru, a medical doctor. Namhlanje sisikhuluma nesokana eliphila nobulwele be-hemophilia. Uzositshela kancane ngecondition le begodu thina singamhelebha ngani ebujameni bakhulu. Hello, Stuart.
Hello.
How are you doing?
Good, thanks, and you?
Thank you so much for joining us today. First question to you would be, what life changes did your parents have to make after you were diagnosed? Do you even still remember?
Yeah, no, I was young, but my dad actually learned how to give me my medication. So he went and he actually learned, researched it. So then I didn't have to go to the clinic every time I had a bleed. So my dad actually, yeah, he learned how to do it. And then just in general, like what causes bleeds. So my parents were like fully informed about that, making sure that if I had a bleed, it was treated. And so I still have use of all my limbs.
Great. So your medication, can you tell us a little bit about your medication and is it effective at all? Does it help you?
The medication is very effective. If you get a bleed, you get a box. It comes with all the components for the injection. You mix it together yourself, and then yeah, you inject yourself with the needles and stuff, and put this factor 8 into your body. You can feel the bleed getting better within a day. Sometimes, depends how bad the bleed is, it can last 5 days or it can last 1 day, just depending on how bad the bleed is. But it's always going to make it better. The treatment always works, so it's very effective, I'd say.
Now, would you say you have a proper understanding of what this disorder is all about?
Yeah, I would. I mean, I've researched it. Obviously, my dad researched it first. And then when I was old enough, I was informed about it. I went to a course to learn how to give it myself. So now I give my injections myself. I know what causes bleeds. I know, like, I'm pretty jacked up about that, yeah.
Hemophilia is a hereditary disorder. Do you hold your parents liable at all?
Of course. No, just joking. No, I don't, not at all. I mean, it's not like they planned for me to have this. It's not like they went out there to give it to me. And I mean, they've been behind me 100% throughout everything. I mean, yeah, I couldn't have asked for better parents in that way. I mean, they've done everything for me. And yeah, no, I don't, if it's not their fault, why blame them? I mean, I still live a wonderful life. I mean, there's no need to blame anyone else.
Are you the only person in the family that has hemophilia?
No, my mom's sister, well, my cousin, also has it. He's a few years younger than me.
As we're about to go to our experts, what would you like to learn from the session?
I think I'd just like to learn more facts about hemophilia. You know, just things that I might not know. Like I know most of it, but there's just always that area of uncertainty that I would like, and then just ask them questions and to inform me more about it.
Ngicabanga bonyana uStuart uyikakaramba begodu usibonelo esihle kithi sonke. Usazohlangana with our experts ekungibo ebazomhlathululela ngokungeneleleko ngobulwele lobu. Bamnikele nendlela ezingamhelebha bonyana alwisane nabo. Ningalinge nichite. Nasibiyako sihlala phasi noStuart nezaziza namhlanje uDr Mogodu ne-genetic counselor uJulie Milan. Ningalinge nichite. Welcome back usahlezi nayo iLivet. Sisakhuluma ngehemophilia okuyi-condition ebangela ukopha without clotting. Sino Stuart sizokhamba siyokuhlangana nezazi zethu zanamhlanje sikungasikade. Stuart, are you ready? Let's go. Sikhuluma noDr Mogodu oyi-general practitioner noJulie Milan oyi-genetic counselor. Ngibo ebazokusiza uStuart azwisise kangcono ukugulokhu begodu angaphila njani nabo. Hello everyone.
Hi.
How are you guys doing?
Fine. Fine.
I am great. So doctor, umbuzo wami wokuthoma ukuthi ihemophilia iyabujugulula uphilo bomuntu na?
Hemophilia has stopped anyone from leading a normal life. You lead a very, very healthy, normal life, but obviously one needs to know what the genetic component of that hemophilia is. And always hang around with people who always understand, or in case of emergencies, just like any other disease.
So umuntu angakhona ukuthi adlale imidlalo efana nabo makhakhulararhwe contact sports.
Yes, but like I indicated from in the beginning, or once you have identified what kind of a gene, because I'm sure the genetic counselor will always highlight there are different types of coagulation processes. So there are different factors which are responsible for clotting. You need to know this is the clotting factor that is deficient in my body. So when you play rugby, because the risk of getting or bleeding injuries are very, very high in contact sport. So the doctor or whoever is, you need to disclose. It's always better to disclose so that they know better how to handle your situation in case there is suspected bleeding.
Like Doctor said, contact sports, usually what we tell our children is, you must be careful doing contact sports because yes, it's something like rugby, we do see head injuries and those are the ones that you would like to not have if you have hemophilia. So for myself, with regards, I've also got a son with hemophilia. I won't allow him to play contact sport just for that reason. I know nowadays with prophylaxis, people tend to say they can live much more normal, which is absolutely right. But there's some things that, we will take good care of before we decide.
Asithi-ke umuntu uhlangabezana nama-situations afana nalayo uyathoma uyopha namthana uyalimala abantu ahlangana nabo bangamsiza njani?
Just like any bleeding patient or any bleeding victim, there are the ABCs of life, of resuscitation. Where you need to stop the bleeding. If the bleeding doesn't stop, with the paramedics around, then obviously the first thing that you suspect could be this person might be having hemophilia. Then that becomes an emergency. It becomes an emergency, and those who are around should actually indicate as to whether the bleeding has stopped or the bleeding hasn't stopped. And even when they go to the hospital, it becomes an emergency, further emergency. And fortunately, if the patient is fully awake, then they'll be able to disclose, to say, I'm a hemophilia. And from there, because obviously there's that organization, the hemophilic organization. I normally say hemophilia should be treated like any allergy kind of a thing when they need to wear, that band, to identify themselves as I'm hemophilic. Sometimes someone may go unconscious, they're not able to tell. That band will have that kind of a number that you can do. So the bottom line is resuscitation, basic life support would definitely help. But that patient has to be taken to the nearest hospital.
Julie, you mentioned a drug that you can use to help and control the hemophilia. Can you please tell us a little bit about that?
Yes, sure. Hemophilia is treated by intravenously giving factor VIII, replacing that clotting factor that's missing in the body. That's what we do to treat hemophilia. Hemophilia usually has either factor VIII or factor IX deficiency, and depending which one, if you've got hemophilia A or hemophilia B, you should be treated with factor VIII or IX as quickly as possible when you have a bleed. Nowadays, we are fortunate enough in private practice, our patients can be on what we call prophylaxis. So we tend to treat them before they get a bleed to try and prevent joint damage and all those kinds of things. So our patients that are on factor or prophylaxis, they usually get their factor 3 or 2 times a week, so to try and prevent bleeds before it happens.
Doctor, can you explain what happens if you don't treat a bleed?
Bleeding depends where it is, but that patient will continuously bleed until the bleeding is stopped. Now, the worst case scenario would be intracranial bleeding. The brain is an enclosed cavity. There's no space. Any fluid accumulation in there creates pressure, and that pressure will start pressurizing certain areas. That's why other people will have a cerebrovascular accident, like what you call a stroke. And it bleeds inside the joint will get swollen and swollen and swollen until it gets heavier and heavier. Unfortunately, the treatment is we need to stop the bleeding.
Like Dr. said, with regards to the joint bleeds, what also happens is if you get more than one joint bleed in a certain joint, you can get what we call a target joint, which means that collection of blood inside that joint makes that cartilage in there get damaged. And then you can end up very young having a joint that actually has arthritis in it. And it gets a stiff joint and it's very, very painful to have. So that's why, as Doctor said, we need to treat a bleed as soon as possible to prevent future damage in joints.
So what I'd like to know is, what is the likelihood of someone getting this condition?
Hemophilia is an inherited bleeding condition. So usually in the majority of our patients, we see a family history of hemophilia in the family. But there is about 30% of our hemophilia patients who are new mutations, which means the mother was the first one who had the mistake, if I can call a mutation a mistake, on one of the 2 genes, the hemophilia or the factor VIII gene or the factor IX gene. Or the baby was the first one to have that mutation. So if you haven't got a history, the likelihood is not very high to get hemophilia. But if you've got a history of hemophilia in your family, obviously then for boys, there is a high risk to get hemophilia.
Speaking of boys, why is it only common amongst boys?
Hemophilia is what we call the X-linked recessive disorder. What it means is the gene that causes the hemophilia is carried on our sex chromosomes, and in this case, the X chromosomes. Now, as females, we have got 2 X chromosomes. So that's why you don't often see a woman or a daughter, a girl with hemophilia, because we've got 2 X chromosomes. In boys, we get an X and a Y chromosome. And because there's only 1 X chromosome, it means if you inherit the gene, the faulty gene from your mother, you're going to have hemophilia because you haven't got a normal copy to compensate for the abnormal gene. Therefore, we say the mothers are the carriers and they can pass it on to their sons. What we see, if a mother is a carrier, 50% of her sons can have hemophilia. And if it is a daughter that she gives birth to, 50% of her daughters will also be carriers of the hemophilia gene. We do see about 10% of women who actually also show signs of hemophilia, even though they have 2 X chromosomes. Not as severe as we see in the boys, but we do get some women carriers who do tend to bleed more often than others.
How serious can hemophilia get?
Hemophilia, when left untreated, can become a very serious disease. When we talked about having a joint bleed, what it means is if hemophilia is left untreated in joints, we can get a person ending up having a disability. They might have a stiff joint, a stiff knee, a stiff ankle, and that can then lead to them suffering at work, suffering to get a job and keep a job. Then the other bleeds are the ones that we are even more worried about is the intracranial bleeds, where it is a bleeding on the brain, and those ones can actually lead to death if they are not detected early enough. We also get your gastrial bleeds, all of those. So hemophilia is a treatable disease nowadays because we have got very good products available to treat bleeds. But if left untreated, and if we have not got access to all our people with hemophilia to factor, then it can be a very debilitating disease.
How long does it take for you to actually diagnose, or how soon can you diagnose a person?
Hemophilia. It depends. Usually in our severe, because hemophilia can also be classified in 3 groups, severe, mild and moderate. Our severe patients tend to bleed without going through severe trauma. And those patients are usually diagnosed within the first 2 years of life. What we see sometimes in our babies, we see babies bruising very easily just from picking them up. They've got these bruises. Often, people are thinking you are mistreating your child, but then actually this child has got hemophilia. So the severe cases we can diagnose quite early. If a severe bleed happens without any reason, that's one of the first things the doctor will actually investigate to try and determine.
Stuart, any questions?
How many people in South Africa have hemophilia?
On our register, we've got just over 2,000 patients with hemophilia. But given the incidence of hemophilia of about 1 in 10,000 people, 1 in 5,000 boys, as we say, we should have around about 5,000 people in South Africa with hemophilia. Worldwide, they say there are over 400,000 people living with hemophilia. So we are missing some, and we are in the process of trying to get as much of those people as possible on our registers.
What would happen if I married a woman that is not a carrier and I'm hemophiliac? What would my children end up being?
When the father has got hemophilia and he marries a woman who's not a carrier of hemophilia, then it means, because if you have sons, you will pass on the Y chromosome to your sons, and they will get the X chromosome from their mother. So none of your sons will have hemophilia, but you will pass on an X chromosome to your daughters, and your X chromosome carries the mutation for hemophilia. So all your daughters will also be carriers of the hemophilia gene.
This is what normally happens. You separate the genes. It's XX, XY. This is a female and this is a male. Now what you do is that you cross X from the female and an X from the male. It gives you a female because it's double X. This X and the Y gives you a boy. You go to the next X, you cross with this X, it gives you another female who will be a carrier because the father is hemophilic. You cross this X and that Y gives you a normal boy, not a carrier, but from here, X and X, because this is hemophilic, this girl is a carrier.
Thank you so much for all the information. I'm sure Stuart and I learned so much more about hemophilia.
It's a pleasure.
Awa-ke zokala sengathi izinluleko ezizoba lihelebho khulu kwamambala kuStuart lezo. Nasibuyako, it's more on hemophilia. Ningachiti. You are still watching Live It. Kulaba baqeda ukungena namhlanje sisikhuluma ngehemophilia, okuyi-condition ebangela ukopha excessively. Ngaphambi kobanyana sichinge entolo sibe nethuba lokuthola yonke imininingwane nendlela zokuphilisana nayo ihemophilia. Stuart, how do you think you're going to use all the information and advice you got from our experts today?
Oh, no, I think it's definitely going to help me with hemophilia and controlling it, making sure that I don't injure myself, don't hurt my body, just keep everything I learned, keep it in mind when every time I do something. I've got a lot more information on hemophilia now, and I think it's really going to help me, and hopefully it helps the others at home.
What advice would you give to other hemophiliacs at home?
Live a normal life. I mean, hemophilia, yeah, it sucks sometimes. You have to give yourself injections, you're sore, but I mean, it's not the worst disease in the world. I mean, you can get over it, you can't cure it, but I mean, it doesn't affect you that much. As long as you keep it in control, live a life. If you want to do something, do it. obviously don't play rugby, there's anything stupid like that, but I mean, just have fun. I mean, don't let the disease control you, rather control it.
Can you please tell us a little bit about your active lifestyle?
Ever since I was young, I've been really into sport. I've always done lots of sport, even some of the sports that I wasn't meant to. With hemophilia, you just have to ensure that you warm up before every session, before you do any activity. Just warm up, make sure stretch, because if you tear a muscle, it's going to bleed into that muscle and it's going to make it a lot worse. So just preventive measures, making sure you stretch, making sure you warm up, and then otherwise it's just pretty normal. Get on, do your stuff. Then yeah, like there's nothing really else you can do. Maybe, but what I do is prophylaxis at the moment, which is I give factor every 3 days. So it prevents you from getting a bleed. So you don't wait until you get a bleed, it just prevents it. So you live a normal life, never have to worry about missing training or anything like that.
Thank you so much for joining us today, Stuart. I'm happy to hear that you learned enough and everything that you needed from our experts today, and I wish you all the best, man.
Thank you.
Thank you. Just like that, sesifike emaphethelweni ehlelo lanamhlanje singithemba bonyana nilithabele. Nikhumbule bona ningathola yonke imininingwane ngehemophilia on these sites. Here are some websites you can check out about today's topic. Ngithemba bonyana ihlelo lanamhlanje silinifundise kunengi. Asiziphindeni kodwa iveke ezako ngesinye isiqephu esizele ngolwazi. Until then, adios.